Welcome to this review of high-yield images for the USMLE, Part 1. The first image is a picture of a renal artery aneurysm, which you can see here. These lesions happen in fibromuscular dysplasia, and the typical clinical presentation would be that of a young woman with hypertension due to the renal stenosis and perhaps some CNS symptoms. Here you can see the Councilman body, which is an apoptotic body in the hepatocyte in the context of an acute viral hepatitis and for the step 1 exam, especially in yellow fever. Here you have an image of acute pyelonephritis, which is just tubules filled with neutrophils. So these neutrophils form casts inside of the tubules. The context in which you will see this acute pyelonephritis in the step 1 exam might involve, for example, a woman with a urinary tract infection. Next up is Kawasaki disease, which has this very typical clinical presentation of the strawberry tongue, which is bright red with these whitish papules. This disease usually happens in children and is a vasculitis of medium-sized vessels, which can lead to dilation of the coronary arteries and rashes. This is an example of secondary tuberculosis or tuberculosis reactivation. In the upper lobes, you have the tuberculosis cavities. On the exam, you might see this image, for example, in a patient that is immunosuppressed with HIV/AIDS or that undergoes some type of immunosuppressive therapy. This is an example of cholesterol embolism. On the USMLE, they like to give the example of an abdominal aortic aneurysm that after surgical repair releases these cholesterol emboli to the distal extremities where they clog up the vessels and form areas of necrosis, like you see here. This is a psoas muscle abscess, here visible on the left side on this CT scan. The usual symptoms that patients encounter when they have a psoas muscle abscess are impossibility to do flexion of the hip, back pain, and fever. This is an example of a chondrosarcoma. You can see this bluish matrix, which is typical for cartilaginous tissue. However, the chondrocytes are quite atypical. And the presentation for this would involve an older patient perhaps with a growing lesion in the thigh with pain and calcifications visible on X-ray. This CT scan is just to show you that there are questions regarding the preferred neurosurgical approach to the neural canal. So when you have disease of the neural canal, the preferred approach is the posterior one that involves cutting the vertebral lamina. CMV pneumonitis, which is common in immunosuppressed patients, frequently seen with this owl eye inclusion inside the nucleus and several basophilic cytoplasmic inclusions. Another example of the owl eye appearance in Hodgkin's lymphoma, this is the famous Reed-Sternberg cell, which has 2 nuclei, so 2 owl eyes with 2 very prominent nucleoli. The typical clinical presentation for a patient with Hodgkin's lymphoma would be someone in their 20s, 30s who presents with weight loss and fever. This is dermatomyositis, which is an inflammatory disease with muscle inflammation, muscle fatigue, and pain, and a rash which appears on the hands as well as on the face with a predisposition to appear around the eyes, and this is called a heliotropic rash. This is a bone marrow biopsy with numerous megakaryocytes which are highlighted in red. These megakaryocytes are increased in number, and if the clinical vignette would tell you that this patient had a viral infection and now suffers very easily from bruises, this could mean that there is peripheral platelet destruction via an autoimmune mechanism, which leads to the increase of the megakaryocytes in the bone marrow. These are sodium monourate crystals, which are birefringent, as we see here. This is due to gout. Bullous pemphigoid, it's an autoimmune disease which has these very tense blisters. This is caused by autoantibodies against hemidesmosomes, which are the structures that hold the epithelial cells attached to the basement membrane. Pemphigus vulgaris typically presents with oral lesions, and they might ask you this on the exam, and the bullous lesions are what we call Nikolsky positive, which means that they are very easy to break when touched, in opposition with the lesions of bullous pemphigoid, which are much harder to break. Here you have an example of a pneumothorax on the right side. This leads clinically to decreased breath sounds because you have all this air surrounding the lung, so it makes it harder for the doctor to actually hear, this should be an ear, to actually hear sounds coming from the lung through all this air. This is a meningioma, the most common brain tumor in adults. It is extraaxial and usually presses on the parenchyma underneath it. Here is an example of pneumoperitoneum in which you can see air under the diaphragm. A good clinical vignette for this would be that of a patient with a history of peptic ulcer presenting to the ER with this X-ray. This could mean that the ulcer has perforated and air is escaping through the stomach into the peritoneal cavity, and because air likes to ascend, you will see it under the diaphragm. And finally, red blood cell stippling, which is actually a sign of lead poisoning due to the fact that lead inhibits the enzyme that is supposed to degrade ribosomes, so these basophilic granules are actually remnants of ribosomes. Thank you very much for listening. Stay tuned for the second part.